I always used to think about research and, visions of pipettes and beakers always came to my mind, and did that in college, and really didn't think that research would ever be a place for me. So that's why I really pivoted into medicine, because I thought taking care of patients was where I really wanted to be. But in medical school, you really start to learn about the social determinants of health and the ways that prohibit our patients from getting the care and access that they need. And people were doing this in a research oriented way, in a systematic way, to really publish and try to change these things. And that's what got me super excited. I was like, I can do research to try to limit the amount of barriers that our patients are facing. Um, and in my own clinic, working at a colposcopy clinic, there was so many people that weren't showing up to their appointments that they would have no show after no show after no show. And we'd finally get them in 18 to 24 months after the initial abnormal pap smear. And thankfully, none of those were cancer, but I could easily imagine that those are situations where cancer could happen. And so when you read the statistics and you see that um, only 14,000 people in the United States get cancer, and that the incidence rates are about seven for when you consider the whole population. But when you think about non-Hispanic Black populations or Latinx populations, those numbers jump up to 12, 15, 16. And so almost double that of non-Hispanic white populations. That's where, and thinking about the patients I saw in my clinic that didn't show up, that's where it really inspired me to really continue to pursue that question in with all those things. There's so many different questions that you can ask about how do we better deliver care? How do we address these inequities that we see in cervical cancer and cancer prevention, really delivery? And so that's why I have become a cancer researcher and a cancer prevention researcher specifically, especially as a family medicine physician. The last thing I'll say is that I think that, being a family medicine physician, you're able to really inform your research by the experiences you have as a clinician. It's just such a powerful view that is not privy to everyone that doesn't take care of and is not in the trenches taking care of these people.